Good evening, everybody. Night number 2 for ALS Treatment Week, and it's going to be a wonderful show tonight. I cannot tell you how excited I am to have our guest on here in just a moment. We've got a gentleman who has been participating in the Biogen trial. Tonight is all about, guys, treatments. As you know, all week long we're going to be doing this. This is a really, really exciting night because tonight we're going to focus on genetic therapies such as ASOs. As you may be aware, Biogen has several new exciting genetic type therapies and ASOs to treat familial ALS. So if you or your loved one has familial ALS, tonight is the night you really want to listen. Now, I will say this, though. If you have sporadic ALS, like many of us do and many of you out there, it's okay because some of this will cross over into that world. As always, feel free to go ahead and please send me your questions as we go. You know, we're live here as we're going. So literally, I'm getting your questions real time. If you're having any trouble with the stream, again, don't worry. We are recording it and we'll have everything up as well. I know last night was crazy. I had a little cool intro video with some Van Halen in it, and I got flagged for a copyright violation on that. So what I have to do is go back and cut that part out, and then I'll post it. All of them will be up on our YouTube page. But so tonight won't have any of those issues. I promise I won't. I'll make sure we don't have any Van Halen in the background. So we'll get going here. I'm really excited about our guest tonight. This is ALS Treatment Week, and we're going to focus on a new therapy every night. Tonight being, again, night number 2, Tuesday night, familial ALS, genetics, ASOs, all those kind of good things. And then throughout the week, we're going to keep going with other drugs. The ones you're familiar with, again, arimoclomol, 35, radicava, Neuron, Tregs, Rapa. You know, we're going to talk about all these throughout the week. And at the end of the list there, the two that the one that many people are interested in is this new Biogen tofersen trial. There's an FUS drug. I mean, we got all kinds of new exciting genetic therapies coming up. And it's very exciting to see some of these working. I will say that some of these are working apparently very well. Tofersen seems to be doing well. Some of the other ones may be still a little bit further behind, but we're going to go over each of these tonight, where they're at in the process, and then of course we will also have the best place for you to go to find all of these trials. And we're going to talk a little bit, just briefly, about the Signal platform on IMALS's website, so you can go find these trials, which is really, really exciting. So I want to go ahead and I want to introduce my guest now. I'm going to find his little picture here. It's amazing. Eric Chun, I saw Eric the other night. It was really cool on another webcast from Everything ALS. And I want to thank them. There will be some video tonight of Dr. Bob Brown talking about his involvement in the history of genetic therapies. He did a really good webcast the other night. So you'll see some videos interspersed in here tonight with Dr. Brown. So without any further ado, really, I want to bring in now my guest, Eric Chun, all the way live from Honolulu, Hawaii. And it's a little bit, or I'm sorry, is it Honolulu, Eric? And
yeah,
I apologize.
I am.
It's windy there on the island. I can only imagine. He said he lives in a valley, and I can't imagine how beautiful it is out there. So, mahalo, my friend. How are you doing? And please take just a moment, introduce yourself, buddy, if you would.
Aloha, Mike. Hey, man. Thank you so much for having me on. You've done so much, and I'm really inspired by your group here, and it's been great to find. It's been inspirational to find a group like this to share our experience.
You were in a really exciting, or I guess still are, in a really exciting new trial. It's the Biogen tofersen trial. We'll again, after we're finished here, I'm going to go over this a lot more in detail. But why don't you tell us just for a second, Give us the like 30-second version of when you were diagnosed and how you knew something was wrong, if you don't mind.
Yeah, ALS is something that I've been aware of my whole life. My grandmother passed from it when I was 1 year old. So we obviously have the genetic form of the disease, namely SOD1.
Yeah.
So when I was a teenager, my mom's twin sister came down with it. She passed very quickly, and then in 2002, my own mother was diagnosed. Now she fought it, and she led a long battle actually, and was actually on a ventilator and fully paralyzed for about 6 years. We had a wonderful care group, which I can go into later. But we lost mom in 2008.
Yeah. So sorry.
So, thank you. So it's something I've always been aware of, and of course, denied to myself that I would never have to be.
Yeah.
I don't know if these are thinking positively or denial. One of those. But in 2018, in the summer, I felt the fasciculation,
Okay. Okay.
and it started here in my right arm.
Started in your right arm. Yeah.
So, knowing what I know, I was pretty sure what was happening. And
Yeah.
we
Kind of
then,
had an idea, of course.
right,
Yeah.
which I know a lot of people, this is a surprise for.
Yeah.
For me, I recognize the early signs.
Yeah.
So within 4 months, I was diagnosed.
Okay.
Even though I knew already,
Right.
I kind of waited, and I went to see my local neurologist. But I wanted to get some better help, and I wanted to see if there was more progressive trials out there.
Mm-hmm.
And I wasn't getting much help here. So I set up an appointment at Cedar Sinai
Okay.
in LA. And I went to see Dr. Balo.
Okay.
No, Dr. Balo. And it was there that they, it was night and day. Like the level of treatment and that they offered, but
Great place.
they're the ones who include me. They include me in on the Biogen trial.
Okay. So you heard about
yeah.
it from Cedars. Yeah. Cool.
I did.
Okay.
So right away I went and I contacted them, and by the grace of God, I was allowed into the trial.
Okay. Okay.
And fit the criteria. At that time, I had only weakness in my right arm.
Right on.
And started to.
Mm-hmm.
I went into the placebo trial.
Okay.
I'd say from May of 2019 to November.
Okay.
I was in phase 3. And then subsequently I was allowed into the extension.
Oh, okay.
So
great. Okay.
So I have to say great things about Biogen.
Awesome.
And
Please
what
do.
they have
Please
offered to me. Yeah.
Okay. Okay.
They, the extension was never in question. It was, I knew I would be able to get into it from the start.
That's great, man.
And,
Awesome. I'm just showing the
that
slide
weather-
here of the Biogen. The trial we're talking about here is the one in green. This is BIIB067, tofersen. And as you can see, Eric, thanks to your hard work, the trial is fully enrolled now, and phase 3 is underway, as you may be aware, and which is great. So go ahead. I didn't mean to interrupt you there, but please go right
Thank
ahead.
you. No. So as some of you may know, tofersen is a RNA silencer.
That's right.
It's designed for genetic onset. So I guess the science, it's, you can look it up, but it's
Sure.
to stop the RNA from producing the SOD1 protein.
Correct.
I would have to say that I can only compare it to watching my mom's progression and her sister, but it has, in my opinion, slowed the progression significantly.
Good. Good. So you do feel it has helped you.
I do.
Awesome, man. That's great news. Great news.
It's great, and I know I sound terrible, but
That's okay. I speak ALS very well, and actually you don't
Good,
you don't
good.
sound that bad to me. I know it's really windy there, and you're fighting that. So, but no, it's amazing. I'm so
Okay.
happy for you. Yeah, go ahead.
I hope you can all understand me.
I'll go back through and I'll touch up the audio on the recorded version. So you're doing great, man. Go right ahead.
Okay. My progression actually was pretty plateaued
Okay.
through to the end of 2019 through 2020. Up
Okay.
until it wasn't until this fall,
Okay.
the last 4 months, that I started to get bulbar onset.
Okay.
It started with chewing,
Right.
lack of swallowing and talking.
Okay.
So, but I'm still eating and drinking all my foods,
Right.
and my left arm is starting to have problems, but my legs, nothing wrong with my legs.
Oh wow, that's great. That's great. If we could only take my, if I could have your legs and you could have my upper body, we'd be golden, right? We'll
It's
trade.
gorgeous, man.
Let me ask you one quick question, Eric. How many lumbar punctures have you had at this point? If you're comfortable saying, you don't have to say, that's private information, of course. But
Not a problem. More than I would ever imagine I could ever have. I would say maybe over 20.
wow,
Or,
wow, that's a lot.
it's a monthly. Yeah, every 4 weeks, I fly to San Diego
Okay.
and get my book. So
Okay.
that being said, they do a phenomenal job,
Yes.
and I don't feel it. I mean, they do it right. So I just kind of meditate for 10 minutes
Right.
while it's happening.
Absolutely. You just got to go. They go slow, and if everything, I do the same thing. When I was in the neurone trial, I would just wait, try to relax. The hardest part for me, Eric, was trying to relax and not be tense. Because if you tense up, it makes it harder to get the needle through there.
Yeah.
Yeah. And
I just like,
I know we've all had probably at least one bad experience, and they were fantastic. I went to the Healy Center; they were wonderful people. But I always worried that they would, when you feel that pressure. My biggest fear was that it would pop, and then they would hit like my nerve, and I would go through the ceiling.
right. I'm afraid of spazzing and breaking the needle.
That's right.
Silly.
Yeah. So I just want to say, real quick, that for all of you who've been in these trials, let me just give a quick shout out to the people in the tofersen trial, the neurone trial, and any trial, ASO trial, the FUS trial, any of these trials that require this, these spinal taps, essentially these injections. Thank you, because really, Eric, what you've done, and I thought I had a lot at like 10 or 12, but what you guys have done for this disease is amazing. This is a commitment, and the people in these trials should be thanked, because they are going to be part of history one day, and that's amazing that you've been through so many of those. And I'm sure all the other ALS patients would love to be in these trials. And yes, it's very sad many were not allowed to do that. But to those who did make it through and got all those spinal injections, thank you so much for your commitment. And Eric is one of these people that got 22 now. I think 22 is the number, I think, for the trial, if I'm not mistaken. And you mentioned Biogen's commitment to you. That's a fantastic commitment. How long have they offered you, if you don't mind, how long have they offered to let you continue, or is that part of the plan now for you?
Yes, believe it or not, 4 years.
4 years. Okay, I think you said that. I'm sorry. Yeah.
From the end of the placebo trial.
Wow.
So I'm about a year and 2 months.
Wow.
So I'm gonna continue going. Yeah, I feel so blessed by this.
Absolutely.
So, lumbar punctures or not, I'm just so happy to be able to do it.
Absolutely. I'm sure you're familiar. Oh, go ahead, man. Sorry. I'm sorry there's a little delay, folks. That's why we're having a little trouble. He's all the way on halfway across the earth. So sorry for the delay, but we'll work that out. Go ahead and finish your thought there, and then I want to show you a little video here. But go right ahead, Eric.
Great. No, I just want to thank Biogen. They not only have offered me this, but they paid for my airfare and hotel, and they made it very easy.
Wow.
To participate. Yeah.
That is truly amazing. Thankfully, they've got Biogen's a very well-funded company. They've had some really good successes, drug successes, and it's wonderful that they're doing this. For those of you out here who don't know, ALS drug development has been very difficult, typically because of the low success rate, over 80 failed trials now in ALS, and that's why every point matters. I want to show you this just really briefly, why each point matters so much for this disease. Here's a slide that shows exactly why every point on the ALS-FRS scale matters. Look at that, Eric. Each point reduction on the FRS scale is accompanied by a 7% decline in quality of life. That's incredible. Here's an example of a 1-point difference. Ability to turn in bed without assistance, requiring a wheelchair versus walking with assistant, being able to feed themselves, independence to dress oneself. That's huge. And then this statement from the FDA it was about COVID, but there's a 35% improvement in survival is a substantial clinical benefit. So, Eric, the reason I show those is just to illustrate to folks out there, and I know people who have ALS already understand this, but that little bit of difference, man, it makes a huge difference. Every single point matters, and every little bit of retained function matters, frankly. And when we get to the ability, and I hope that we'll start hearing some really good success stories from your trial, the tofersen trial. I've seen and heard of a couple of people who've had extremely good results, in some cases coming close to slowing down their progression almost to a halt. I can't verify that yet for our watchers. Have you, now let's go totally speculative here for a moment. Have you heard any cases of people in the trial that have had a superior result to even your own, Eric? If you can comment on that, if not, I understand.
No problem. I've had limited contact with a couple of other patients, and actually, so they also have a C9 treatment for the C9 mutation as well.
Okay.
I've talked to one of those patients, and
Yes.
she seemed like really happy.
Oh, really? From
It's
the
when I
C9
ta-
from the
when I
C9
talked to her.
Biogen trial. Okay. Okay.
Yeah. So
Okay.
it's I don't know what's one is more effective than the other, but
Yeah.
I haven't talked to her recently, but in my experience, she was very happy. She seemed like she had plateaued when I talked to her.
Great.
Um,
That's awesome. That's great news. I know, as you're probably aware, I think there's a former hockey player named Chris Snow who's on in the same trial you are. Have you heard of Chris? And have you talked to
I
Chris?
have.
Have you spoken with him at all?
I have not talked to him, no.
Okay. All right. That's fine. I was just curious if you'd
Yeah.
managed to make contact with him. I think he seems to be having some pretty fair results. I've been seeing some of his posts or from his family and things. So, man, every point counts, doesn't it, Eric? At this point, it really does.
It doesn't. And no, I talk to the doctors. I always ask the researchers, how are the other patients, and they can't talk too much about it, but
Right. Of course, it's blinded.
they have said that, they've seen really good results like respiratory function. Uh, mainly, like that's what they've told me. So
Okay. So they have seen
they,
some good results then.
yeah. So as far as what they can tell me, that's what I've. And they just seem very stoked. Like
Yeah,
like you never see that with ALS doctors or research.
I agree. I agree.
These
I
guys are
heard
excited.
they're excited, absolutely, buddy. And I heard one story, and again, this is it's kind of speculation. It's more like secondhand information, but I heard that during the MND conference, I think it was December of 2019, that when I think it was when either the phase 2 results had been announced or something. Could have been, maybe it was early phase 3 results. I'm not really sure, but that some of the people involved at that conference were actually kind of even tearing up a little bit over some of the results from the tofersen trial that they had seen. And again, I wish I had confirmation of that specifically, but my sources are usually pretty spot on. So, and what you just kind of said about the hope and that they don't normally act like that, just like when Dr. Stanley Appel said that he had stopped progression of ALS with his Treg trial, most people were kind of stunned at that, like, because it's hard to get a real answer out of doctors and attorneys, right? So when you do get that kind of answer, you have to put a lot of faith in that. Some of the best doctors in the world are involved, with this trial, frankly. And let's talk just for a sec. I actually want to show this video real quick about expanded access, and there's a lot of hope out there, Eric, that Biogen will offer this under expanded access, and I want to say thank you for being complimentary to them. I do too. I really do. There's, we've estimated, it's hard to say because the estimates vary, but between 200 and 400 people could be really helped by this drug, and here's what Dr. Brown said just really quickly, and this video comes courtesy of Everything ALS, but here's what he said about about expanded access, just briefly. It's sort of like a minute video.
So in the context of SOD1, now that we have some promising therapies out there, given that there's some really rare mutations, what are your thoughts on using expanded access to make that therapy available to everybody? And how could that impact the clinical trial data?
Yeah, well, I mean, if Biogen has something that's very, very promising, if they wanted to make it available for a subpopulation in an expanded access mode, they could. And there's no doubt that would, I think that would probably help a lot of people. I mean, there are many reasons why a company has reservations about doing that, as I know you know. One is financial, the other is what happens if a few people have particularly bad side effects. And so the company is very sensitive to being certain that a drug in trial is administered in a way that optimizes its chance of success.
But there would be no difference in expanded access versus the clinical trial if you or Merritt or Jeff Rothstein was doing it. The risk would be the same in the clinical trial population,
yes,
and the expanded access population?
Yes and no. I mean, right now, most of these companies pick very carefully the type of patients they want to treat. So they have inclusion, as you know, and exclusion criteria. And so that sets a kind of filter for optimizing patients who they think will respond favorably. If you broaden that and take all comers, let's say, and as a clinician, obviously at one level, I'd very much like to do that. But if you broaden the filters and you take all comers, and then there turn out to be some individuals who have adverse effects, the question is, will that taint the drug in the eyes either of the FDA or the marketplace in some way that's unfavorable for the company? I'm making no value judgments here. What I'm trying to share is what I think is, the world of pharmacy's perspective on this.
Okay, so there you go. I'm fascinated by that reply. I think I get the feeling that, I do know Dr. Brown to some extent. He's been very helpful on many levels, and I get the feeling that he would really like, the company to do that, but he's obviously not going to say that, and I'm not going to put words in his mouth, but it sure would be nice if we could give those extra folks a chance. But again, this is ALS, and it's a very difficult disease. Nothing really makes sense. But I'm just thrilled that Biogen has been able to now complete the enrollment of this trial. Because, Eric, as you know, it's not easy to find that many people. And by the way, do you know how many people total were in this trial? I think it was, wasn't it 100? I can't remember. I've got that data here. We're going to go over that.
You do great. I thought it was maybe 60 in the U.S.
See, that sounds better. Yes, between 60 and 80, I think, something like that. Well, either way, but
I mean, maybe
great effort from the company, and we really do obviously appreciate what they're doing. It's a great, very promising drug. I want to show just a quick picture here of, and I showed this one to you earlier. Tell us a little bit about, whoops, sorry, that's not the right one. It's this one right here. Tell us a little bit about this picture. It looks like you guys are in an axe throwing facility. This looks like a fun day for you guys. What was happening here? And I see you in the back.
It was my friend's birthday there, Jeff, and we were at, there's a new axe throwing place here in Honolulu. At that point, I still had good strength in my left arm, so I was whipping those axes left-handed.
That's great. Yeah, that's sporty. Throwing them. I don't know if I could throw anything left-handed. I'd be lucky to even hit the net, let alone hit the target.
I got good with my left arm. I could do chopsticks. I've been writing left-handed, all that stuff. You learn real quick.
That's great. I guess the only other question I had is, do you talk to me a little bit about your level of hope for the future of ALS right now? I wish that a higher percentage of ALS was, well, that's kind of a hard thing to say, but I wish that this drug could help more people. How do you feel personally about the future of this disease, and do you believe that familial ALS, do you think they're closing in on some of these mysteries that we'll discuss after we finish? But what are your thoughts on the future here in the near term?
Well, Mike, I've gone through a journey, in that way. And when I first realized what was happening to me, I had no hope. I really was, because I knew, and I'd seen it enough times.
Of course, you'd seen
And
it.
of course, I was Googling everything. And at that point, 2.5 years ago, there was really nothing on the radar still that I could really find.
Yeah.
And, I think Radicava had just kind of come out.
Yeah.
And I knew Riazole didn't do anything substantial.
That's
Maybe
true.
a few people.
It's true.
And it wasn't until I went to Cedar Sinai and they told me what was going on that the spark of hope came to me finally.
Yeah.
So, for myself. So that being said, for the future, for my kids, I have lots of hope. I mean, I know we're on the verge. I mean,
Yes, I agree.
we're already making it almost there to making it manageable.
I
You know?
totally agree.
So
By
for
using,
us now, you know,
oh,
but
sorry, I was
No,
just to say by
you're
using a combination of drugs, right? And that's what Dr.
Right.
Brown also says, is that this will become a multidisciplinary approach eventually, where we don't just have one drug. And he says flat out, I don't think there's going to be a magic pill. This is going to be a combination of things. Do you agree with that assessment, or do you feel like we might actually just
I
be
do.
able to knock it down?
well, hopefully one day that will be true. But for now, like, of course, I can't wait for neuro to be approved.
Oh, really?
Then I'm hoping I can do that on top of the tofersen.
Okay. So you're familiar with Neuron then, and is that something you would like to try as well?
I do, because that's more downstream, where tofersen is more
Absolutely.
upstream, right?
Great analogy. You just, I'm gonna have to send you a little mean email later, because I was actually gonna talk about upstream and downstream. So you were watching the other night
Cool.
too with me, weren't you, about Dr. Brown? And
Yeah,
it's such a great explanation. I mean, he has it right on, as do you, about up and downstream. I could not agree
Right.
more with you on that. But go ahead. Sorry.
So
to cut you off.
if we can combine the two, um, that would be key to managing.
Okay.
So that being said, I also, I know we don't talk too much about supplementation or
Sure.
vitamins, but I also have added a twice weekly IV of
Okay.
fluid,
A fluid
my
IV?
regimen.
Okay. All right. Okay.
Yep. including a minus cocktail
Okay. Okay.
and
Great.
heavy glutathione.
That's awesome.
So,
Great. Well, since you're out of the
It's,
trial
um,
now, you could probably do some of that, right? I mean, is that still? Have they cleared a lot? Have they cleared you to do anything else, like AMS
Actually-
35, or what's the situation there? You know.
so the issue is I can't do anything else in the trial.
Yes, exactly.
It
While
has
you're in
to
the
be
trial. That's right.
the-
Of course. Of course.
I mean, I can't do anything that is anything else that is
Right.
still.
Right.
So
Okay.
I can
gotcha.
do if it's approved
If it's approved, you
by the
can do it.
FDA.
Okay, gotcha.
Yeah.
How many? How long? Just before I let you go, how long left do you have in the trial? You're getting close after 20 or 21 lumbars right now. So how much longer do you have in the trial, Eric? And then you'll go to
I have
you'll go to expanded access.
I have just under 3 years of expanded access.
Okay, okay. But you're finished with the phase 3 portion, is that right, or is it?
I am.
Okay, gotcha.
I am.
Okay,
I did that those 6 months.
gotcha. And
So,
how often will you have to go back to get monitored now? Is it like a once a month thing for as long as you're in expanded access, or
it is once every month.
once
every
a month?
4 weeks.
And the company's paying for that, your airfare and everything, right?
Yeah.
Wow, that's amazing.
And,
That's
and
great.
I did sit out twice because of COVID.
Wow,
When it first started last year and last month in
wow, that's
December.
awesome.
But otherwise, I've been going every.
That's great, man.
Yeah.
That's amazing, man. Well, I'm seeing some of the comments here, and so it looks like some of your friends are watching, and they're talking about, how amazing you are, and there's a lot of people on here with familial ALS. I see several, as a matter of fact, and
Everybody.
yeah, you get really good positive comments here. And by the way, guys, if you have any questions, better submit them quick. I think my camera's about to die, so I'm going to do the super rabbit battery change if that happens. But Eric, before hopefully I'll get through this. I'll go ahead and let you go. Thank you so much, man, for doing this tonight. I cannot tell you how important this is. Let's stay in touch. I mean, because I'd love to follow your progress. We have a lot in common, you and I, as you know. We talked about it off air. So thank you so much for doing this, my friend, and I wish you nothing but the best. And I'd like to give you one last opportunity to say anything you'd like to everybody out there. And thanks again.
Thank you, Mike, and I appreciate what you're doing. My family appreciates it. I have family on the mainland that's watching, that we've all lived through this. And this is really the first time in history that we have hope. And it just it fills me with so much joy to know that. So I want everyone out there to know that. And we're fighting the good battle, guys. So I want to say aloha from Hawaii.
Absolutely, brother. Mahalo. Thank you so much, my friend. Let's talk again soon. And it's just been my honor to have you on here. And this has been the one of the interviews I'd wanted to do for so long, to hear about this trial. And it sounds very promising. It sounds like there is truly hope out there. And for people with SOD1 variant ALS, and hopefully some of that will bleed over. The JC fusion, we know that's a very aggressive form of ALS, bud. And, maybe as they continue to work and take the data from your body and from your contribution to this, that they will be able to manipulate that and turn that into a genetic therapy for all ALS. I'm with you. I think we're a ways away from the cure of any kind, frankly. So as you mentioned, up and downstream therapies, we're going to talk about that as soon as we get done here, but you were right on the money there, and Dr. Brown is right on the money as well there. So thanks again, man, and thank you so much. Have a great day, and it's still, I know, early afternoon there. Go enjoy that beautiful sunset. I can't imagine how beautiful it is down there. So, and I will if I can get out that way, man. Let's hang out. I'd really love to.
Yeah, sounds good, Mike. Yeah.
All right, bro.
Hello, everyone.
Thank you so much. God bless, and tell your wife I said bye-bye.
Bye-bye.
All right. All righty, there you go, my friends. How about that? Pretty exciting, I would say. I'm going to make one quick adjustment right here to my little streaming machine here. I want to put these. I want to put the slideshow up into my two-shot here. There we go. Okay. So, okie doke. That was amazing, man. Eric is an amazing guy. He's so nice, unlike me, who's I'm just. Everybody's all like, yes, that's true. No, anyway, Eric is amazing. And Biogen is making a big commitment to this drug. $40 billion companies. I want to draw a quick conclusion between Biogen and some of the other companies that are offering these, like, frankly, AMX35. I know we would all absolutely love to have access to AMX35 right now under expanded access. And maybe we can, but it's a very small company. Amylyx is very small. They don't have a lot of money. And maybe if we get lucky, Brainstorm will get $100 million from the sky and more people can get expanded access there. But the ALS drug development game, unfortunately, comes down to money, my friends. And with over 80 failed trials, I heard the CEO or one of the two young kids, I think one's the CEO and one's the president, I'm not totally sure, but I think it might have been Justin that said the other night, was talking about that exact subject, about money and about failed trials, that the general feeling in ALS was, when they were looking for investors, was, oh, it's great, but you're going to have a hard time finding money because of the failure rate. And they're right. Part of that failure rate, frankly, goes back to something we talked about last night, which is the ALS FRS score. And so we've got an issue in ALS, but for tonight, we're going to talk about something a little different. We're going to go ahead, and now we're going to move into the portion of the program where we talk about these specific new therapies. I'm going to list them for you, and if you have familial ALS, this is really going to be good for you. And by the way, somebody mentioned this to me the other day, and I totally agree with it. There was a time in ALS where getting tested for genetics or getting a genetic test done was really a waste of money. There just was nothing that we could really do, frankly, if you did get a genetic test and it was positive. But I think we're approaching a time where I have to say, guys and girls, that I think everybody should get a genetic test at this point. I really do, because it'll help you. It could help you get into a trial, and not only that, but we're approaching a time, I think, where some of these ASOs and some of these intrathecal delivered therapies like tofersen may become available pretty quickly. Think about this. I mean, tofersen's now fully enrolled in phase 3, and if the results are that promising, we should expect a rather rapid review and approval. So, which would be great for everybody with SOD1 type ALS, and that's about, depending on estimates, 300 to 500 people, maybe in the U.S. And we're going to go over the exact numbers, by the way. That's part of what we're going to do tonight as well. So I just want to follow up one last thing about last night's show. Thanks for tuning in. Craig did really, really well. He wanted me to tell you all thank you so much for all the kind comments that you sent him. And as we move forward a little bit now, I want to kind of show you what upstream versus downstream means. You might have heard earlier, you might have heard Eric actually refer to upstream versus downstream, and that's what he means by that is examples of upstream. Well, let's take examples of downstream first. A downstream therapy would be the part of ALS outside of the direct cause. Like the upstream portion would be a genetic malfunction, such as in the SOD1 gene or the C9 gene and that type of stuff. That's actually attacking the problem right at the source. That would be a cure, essentially, if we could figure out a way to stop that from happening in people who know they're going to get ALS. A downstream therapy, or what most of us have been talking about because of sporadic ALS, they address things like neuroinflammation, toxicity, glutamate, which is exactly how they think that riluzole works, is by modifying glutamate. And all of these drugs here, as you can see, these are all downstream drugs, which are exciting. Arimoclomol, AMX35, Radicava, Neuron, Tregs, and Rapa. Even though Neuron is an intrathecal derived therapy, it's still, it's not an upstream therapy because it doesn't really attack the fundamental issue in familial ALS, of course, and what a lot of people think is, frankly, all cases of ALS. Many doctors now believe that, and I know Dr. Appel certainly does, he believes that, quote, that genetics is what loads the gun and environmental issues is what pulls the trigger in ALS. And I would agree with that to a large extent. I really would. So as you can see here again, the more upstream approaches or genetic approaches, and hopefully one day soon we might be getting closer and closer to really becoming effective. I heard that story about some of the doctors tearing up at the presentation, and I kind of tend to believe it. We're starting to see some real progress there, finally, in these genetic derived therapies. And as you'll see in a minute, it's good news because some of these things they believe will work for sporadic as well, by the way. Here's a little picture of a motor neuron. This came from Dr. Brown again. As you can see, guys, I'm not going to spend a lot of time on this, but on the right-hand side there, the fundamental problem of ALS is that early axonal retraction from the muscle. These things pull back from our muscles, and they de-innervate the muscles basically, so that they don't make contact anymore. We lose signal with our motor neurons, and that's the fundamental issue, of course, in ALS. Here's an interesting slide, guys. This is a really good indicator here. This is of all ALS. And this is the thing, you're going to see the numbers vary from case to case, estimate to estimate, trial to trial, but generally speaking, 5 to 10% of all cases of ALS are familial ALS, meaning people were born with it. Their genetics were primed, ready to go, ready to pull the trigger. And out of the 95 cases that are sporadic, totally sporadic, you can see here that things like neuroinflammation, injury, diet, gut. Lately, the gut and the liver has been a big discussion about this. And then probably one of my leading theories for sporadic ALS is mitochondrial dysfunction, as many of you, are aware. Mitochondrial dysfunction is suspected to be a big reason why we have these issues in ALS, or why ALS exists. Here's another slide essentially showing the same thing and showing you that, yes, FTD and ALS are linked. They're very closely linked. As many as 50% of people with ALS, guys, will also get FTD to go along with that, and that's terrible. I mean, I'm absolutely not looking forward to that. Hopefully nobody listening tonight will be in that group. I want everybody to stay healthy there. Tell you what, why don't we go, this is another video courtesy of Everything ALS. Let me just show you who Dr. Brown is, for many of you that don't know. He tells a really good story about the very early part of how how familial ALS was identified and how the family was traced over in Belgium, actually. So just really quickly, let's watch this.
Work that I do is predicated on the observations in 1880 by William Osler that there are familial cases of ALS. You'll see on the right a family tree of a man named Samuel Farr, who was evaluated by Dr. Osler and whose great-great-grandchildren we've had the privilege of following. So these are folks who turn out to have an A4V mutation in SOD1. 3 of the 5 that you see depicted at the bottom here, unfortunately, developed ALS before the age of 40, and because it's A4V, had very short survival. So this defines both the challenge and the opportunity, and that's where we started.
Okay, and let's take a quick look here, guys, at this little chart. Now, this is the 5% of all. This is the 5% of all familial ALS cases right here. And see, again, some people say it's 5, some say it's 10. But the point is this little chart shows you the most common ones. C9 is the most common genetic ALS form there is, or familial ALS form there is. About 54% of all cases of familial are C9. About 14% are SOD1. And then you have others like the TAR-BP and the FUS, known as what unfortunately J.C. Hermstead had. Very aggressive, extremely aggressive. And then there's some others in there that are unknown as well, which is terrible. One thing I find interesting, guys, is the genetic makeup. The racial divide and makeup here for ALS is interesting. And by the way, you'll see why that's important when you think about Radicava and how the numbers were, how that drug was approved using all Asian DNA. And a lot of people have said, I even got one comment that said one time I was kind of being racist or something when I said that, part of the reason is this drug seems to be different in Caucasians or whatever is because of DNA. And it's absolutely true. If you look at this, look at the bottom right here and how much lower familial ALS appears to be in Asian population than Europeans. It's pretty incredible. Much higher incidence of familial ALS. It's interesting. And then you can see up at the top the breakup or the breakdown between that. The most common type of familial ALS is different. Look how high C9 is in European genetics, 33%, versus only 2.3% in Asia. And then SOD1 is very common in Asia, 30%. It's double what it is here in the United States of America, or I should say in Western DNA, Caucasian DNA. Now, I don't know if that's Caucasian and African or African American DNA. I'm not sure on that, but there's a clear difference between Asian DNA and white folks, if you will, between our genetic makeup. And this is one of the reasons I tend to believe that something is not totally accurate with the Radicava data. It's because, it's not exactly apples to apples there. Anyway, that's kind of an interesting observation. And I'll tell you what, let's listen to Dr. Brown one more time, as one of my hard drives is absolutely going crazy here. I'm not sure why. Let's listen to Dr. Brown just one more time real quick. He's gonna tell you about how he got involved in the early 80s. That's how long they've been following familial ALS. But this is a really cool video, and I think you'll get a kick out of this. So yeah, let's listen to him, what he says here.
So in the early 1980s, we undertook to look for ALS genes. This is the first family that we studied, FALS 001. You can see in black the affected individuals over several generations. We studied it with a large and wonderful group of investigators in Boston. Jim Gazella's lab started it. I picked it up after that. Bob Horvitz at MIT was absolutely essential. And at the same time, a large group of very good investigators at Duke undertook the same. Really important is that now there is an army of people looking at ALS genetics, and I've depicted several of them here. Many of these are very well-known neuroscientists, and I'm sure you know of their work. Just as a quick aside, it has been really quite an odyssey.
Okay, so there you go. So, been following it since the early 80s, guys. That's a long time, and Dr. Appel's had some initial work involved in those early trials as well. Here's a cross section of the check this out. This is cool. Here's a cross section of the control versus an ALS spinal cord. As you can see clearly on the left side, the number of motor neurons, and they used a staining technique. The number of motor neurons is much more robust in a control group, and unfortunately, guys, our motor neurons are not doing well, and that's part of the reason that we have these issues. Also, mitochondrial dysfunction. There's been a lot lately about that. A lot of you have heard about MitoQ. That's a new, it's an over-the-counter supplement, MitoQ. It's MITOQ, and a lot of people believe that there may be some truth to that. There might be something going on with mitochondrial dysfunction and energy delivery, and maybe that's why people with weaker mitochondria and people who are type A personalities, thinner framed, typical kind of ALS build, if you will. And there's no, again, you have to stereotype to some extent because no case is ever, it's not 100%. We have people with ALS who don't start out overweight. They're a thinner build, and then we have people with ALS who are quite overweight, and we have people who get overweight like me after they get ALS. So it's really all body types, but as you know, undoubtedly, there's a trend. I mean, people who seem to be thinner, type A personality, high metabolic rates, people with a lot of injuries, right, seem to get ALS. It seems like sporadically more. I'm not really sure why, but the very first study was done back in 2012 and 13, the first in-body study. And we see some big names there. I've highlighted them for you. Dr. Appel and Dr. Sokovich, as you can see here. Down on the bottom, it's interesting. SOD1 caused 13% of familial ALS. And you'll notice, that's a little different number, guys, than was quoted in the other in the other data. So some of this data has been updated and it's changing a little bit as time goes on. But check this out. So this is a trial that was done here. It was called ISIS 33361. And you can see here, one of the things about ASOs is, and why I mentioned to Eric, thank you for doing what he's doing, is some of these ASO trials require countless numbers of intrathecal injections. That they are no fun. I mean, he played it down there a little bit, and yes, when they're done well, they're really not that bad, but they do kind of hurt. And 20 plus intrathecals, and there were some adverse events, from these trials, and there's adverse events in general from getting intrathecals. There's a lot of pain, and then you can get a bad headache. This is a summary of some additional trials here and some additional data. I wanted you to see that it varies. Apparently, these people believed that 10% of all ALS cases are familial. So I think what we've seen here, guys, is that it's somewhere between 5 and 10%, okay? Some people even think it's a little more than that. Generally speaking, I see 5 to 10. Most of you guys see 5 to 10 also being quoted, where superoxide dismutase, or SOD1, being the second most common, C9 being the first most common there in the green box. And again, this proves here in the black boxes there that there's an overlap between ALS and FTD. So yes, the two are related. Again, approximately 50% of people that get ALS or have ALS will also have FTD, which is terrible, obviously. Also there's a debate, as many of you may be aware of. Is there a genetic component to all cases of ALS? Some people think that there is. In the black box at the bottom, as you can see, very bottom, it says there are likely to be many more genetic mutations associated with the disease that we haven't discovered yet. That's true. I'm certain of it. I mean, Dr. Appel feels that way. And then there's also some people in the green box who also believe that, quote, at present, I think if a patient has ALS, which has been classified as sporadic, I still think it's worth a conversation about genetic testing. And there's still a debate over that, like I mentioned. I'll just be honest with you. If you are newly diagnosed right now with ALS, I would recommend it, if you can afford it, to please go ahead and get the genetic test done. It gives you additional information about your own body, and it rules out to see if any of those, if you have any of those pathogenic changes in your genes. The most common ones, especially. The tests are very reliable, and I'll try to post the best price for you. We'll go around, we'll ask for the best price, and we'll try to find that so that you can get that done. You can order it through your doctor, but guys, I would recommend now that you go ahead and you do that. Most neurologists are not recommending that, and I think that is a mistake. I would highly recommend that you do get that done, okay? Just checking my questions here, make sure, see if there's any questions coming in. Doesn't look like it. So that's good. Here's an interesting stat, guys. We estimate from the study that around 17% of sporadic ALS cases can be attributed to known ALS genes, whereas previous estimates have been around 25 to 30. So, in fact, the previous estimates have probably overstated the genetic basis for ALS, as they have included mutations that probably wouldn't be pathogenic. So what that means is you can have mutations, but they may not be pathogenic in the sense that they're replicating enough to cause the full-blown ALS. So my point in showing you these, guys, is that familial ALS, there's still a lot of mystery there, okay? We're talking about upstream versus downstream therapies. It's exactly why we've got to have both of them. And just as Dr. Brown said, he's right on the money about that. He said that we need to be addressing the upstream cause and the downstream cause, both. In an ideal world, we would have both of those. All of us would be taking some sort of genetic component or genetic treatment, and then we would all get some secondary therapy or third therapy, AMX, 35, neurone, Tregs, those kind of things. And I know that as simple as that sounds, for some reason, it's sort of a new concept, at least for ALS, because it's been thought for a long time, and a lot of money has been spent in finding the cure. Somebody like Eric Chun that we just saw, still very functional, and he mentioned it himself. If he could get neurone, or if he could take AMX 35 through a combination effect, I mean, it could potentially halt his ALS. The more things you take, perhaps the better it gets. We don't know. But one thing we do know is that there is no silver bullet, and there's not one coming for anybody alive today. Here's the thing, at No More Excuses, we don't talk about 15 to 20 years down the road much. We don't. And that's what makes our group unique. We're about the now. We're about the people who are alive now with this disease. And that's what Craig and I set out to do 2 years ago, was to try to find the best ways to get drugs into bodies as soon as possible. Talking about Biogen, guys. Let's talk about Biogen. Well, in fact, let me just run one quick video of Dr. Brown talking about this multiple approach, and then we'll go into the Biogen trial and some of these trials so that you can actually check. I'm going to show you where to go to check to see if you are eligible for some of these trials. So here's what Dr. Brown had to say about a multidisciplinary approach.
And as I'm sure you know, what's also very, very exciting is that it is possible now to recreate motor neurons in a petri dish from the patients you see in the clinic.
Now that's
using,
exciting too.
Stem cells. So you take a skin cell or a blood cell, you make a stem cell, and you make a motor neuron, and voila, now you have a model of a patient's own motor neurons in a petri dish, which is pretty amazing. Well, what do these things do finally to the nerve cell? Well, this is meant to be a cartoon of a motor neuron, and what this is meant to show you is the cell body in yellow, the axon that it sprouts to go down to muscle, shown in brown on the right. And I think the main point to say is that almost every part of the motor neuron gets sick in this disease. So there's unplugging, as you know, of the distal terminal from muscle. The way the terminals transport materials up and down is abnormal. The firing patterns are abnormal, with excessive firing in at least part of the disease. And a number of other things are abnormal, such as the manufacture of special RNAs that control RNA development. Mitochondria, which make energy, are defective in many cases. And protein quality control is defective as well. And you know, the interesting thing that makes this so challenging is that different parts of the motor neuron will probably get sick at different times. And what this tells us, I think, is that to treat this disease, you're going to have to treat more than one process. I don't think there'll be one pill. There will not be one drug. There will be a lot of different things that will have to be treated simultaneously, and perhaps even at different phases of the illness. So the complexity is writ large.
Yeah, the complexity of ALS is large. There's no doubt about that. And that's why I believe that we've got to have all of the weapons. You heard me mention last night, to steal one of Michelle Lorenz's favorite lines. She loves to say this, but we need an arsenal for ALS, an arsenal of weaponry. That actually was said by the general who got ALS classified as a service-related disease for the VA, and we need an arsenal. That's why when we're looking at, you know, one or two of these things, and we're debating some of these drugs, like in the case of Neuron, you know, is 36%, you know, 35% across the entire trial, is that good enough for ALS? I mean, that's the question. Guys, would you take it? Is 35% good enough for you? I mean, there's a group of people in that trial that hit the target right on the nose, 35% and 15%, 36% and 15%. I can't remember one of the two. We'll go over Neuron later this week. That's Friday night, by the way. But same thing for AMX35. You know, guys, extends life by 6 months, right? I mean, it's better than nothing, and it should be approved, and it must be approved. And I think, I don't know, we may be surprised about that one. We'll see. But it goes to show you that even a 6-month reduction in death is enough to cause even the ALS Association, who rarely supports anything, to get behind it. You know, of course, it's a drug that they will make some money on, which is fine. And by the way, I don't have any problem with anybody that makes money on drugs. That's what they're supposed to do. We talked last night about cystic fibrosis, guys, about how much they were making on Trikafta. $4 billion. They're worth $4 billion now, and 90% treat. That drug is 90% effective for cystic fibrosis. Amazing. And I say more power to them. Great leadership, great management, and you've got to focus on the drugs that you think have the best chance to slow or stop your disease. And that's what we have not done in ALS. I'm sorry, we have not done it. A group called Terminally Persistent was complaining about this well before No More Excuses was. The money has not been spent properly. I want to move into the Biogen specific portion of this little presentation now, just for a minute. Let's talk about Biogen. This is a great company. They got a lot of manpower, a lot of dollar power, big company. This is the definition of big pharma, guys, when you hear big pharma, but that's fine. And we need some big pharma people involved in ALS. Frankly, I wish Biogen would immediately contact Dr. Appel and see if they could maybe get him to let them help him with T-regs maybe, because they've got the muscle, they've got the reputation, and as you're going to see here, some pretty impressive offerings for ALS. So they have essentially these 4 drugs in their pipeline now. This comes right off their website. The green box is tofersen, SOD1. As you can see there on the right-hand side, phase 1 is done, phase 2 is done, phase 3 is now complete with enrollment. It's not finished yet. That's why it says full there. But guys, that's an amazing lineup. You've got, think about how much it would cost if, say, there's 68, 70 patients in there. They're paying for Eric's airfare. They're paying for all that to do the trial, the hotel visit. I mean, that's a lot of money. That is probably $100 million or more. I don't know, but it's a lot of money. Okay. And what's amazing is that, guys, tofersen's very exciting. And as you can see here, again in the red box, phase 1 result was passed with safety, okay. Phase 2 with initial signs of efficacy, and phase 3 is in trial right now. Anecdotal evidence is building, and frankly, I think we're at a point where compassionate access should be offered, in my opinion. One of the things that we will do, guys, is probably tonight or tomorrow, I'm going to have a link to a petition. And we're going to make an effort to try to get Biogen to offer this drug under expanded access to people, okay? A lot of people have said that, hey, our website, our effort is all about Neuron or one drug. No, it's about the ones that can be done right now or soon, not about ones that are 5 years down the road, okay? We have a petition. We got a petition done for copper ATSM with 200,000 signatures on it. That's right, 200,000, guys. That's huge. And we will be soon sending that to the company. Now, remember, if you'll check our schedule, we're going to talk about each of these drugs for the rest of the week, Wednesday, Thursday, and Friday night. And it's going to be hot and heavy the next 3 nights. And we're going to go over some of these things. We're going to show you what we can do to put some pressure on these companies, including guys, on Biogen. Yes, we need them to offer this drug under expanded access. There's let's say it's 300 to 500 people, roughly right now, in the U.S. Let's say that have the SOD1 variant. That's a lot of people, guys, that could potentially be saved here, if the results are really that good. So one of the other, the most common ALS, familial ALS variant is the C9 type. 35%, roughly, 35% of familial ALS is C9, as you can see here. Well, actually, I took it away. Let me let you see this. Down here where it's circled here, and I'll have all this up in full HD, don't worry. But C9 is the most common variant for familial ALS. It affects a lot of folks, much more than SOD, about double in some cases, roughly, or even more, actually. But you can see here that there's a target drug called BIIB078, and they're working with Ionis Pharmaceuticals on this. And you can see, guys, that this is a drug that targets specific mRNA, messenger RNA, in other words, emerging from the C9 ORF72 gene, and degrades it, removing the RNA and preventing production of the abnormal protein that it encodes. It also preserves the normal C9 protein coming from the gene. So guys, this is an exciting drug. If you have C9, are there anybody out there that have that? Guys, go ahead and send me a message if you'd like. I mean, I'm watching this right now. If you have C9, go ahead and hit us up. Let us know if that's the case that you're in. Let us know if any of you have SOD1, by the way. Please, by all means. We're going to try to keep track of some of this. But I would like to ask all of you a favor when it comes to doing the petition, okay, for this drug right here, BIIB 067. I understand that it won't help most of us, okay, but I would like to ask you a favor, if you don't mind. When we get this petition up, I'd appreciate your willingness to sign it. We'll have it up on change.org within the next 24 hours. I mean, I've already got it, but I'll show you, I'll post it and show you where it's at, make sure it's the right one. So please don't do anything yet. But we really want to pressure Biogen into doing this in a nice way, because they're a $40 billion company, guys. I mean, the amount of money that it would take, Biogen to offer this would be like us finding the money in our couch cushions, essentially. And I would urge and please ask that company to do the right thing. A lot of people need this drug right now and will not be able to get it for at least another probably year, let's say, best case scenario. If the FDA moves really quick, it's probably going to be longer than that. But guys, let's try to please at least let them offer it as an option, that maybe where people could pay their own airfare to go get it. I know that would be a huge burden, but we'll take anything at this point. Patients, we'll take absolutely anything. The reason we exist here at No More Excuses is to try to force action to these drugs. And I would appreciate it and consider it a favor if you guys would sign this petition. We also have the one, as I mentioned, from Copper ATSM the other night, and we're going to be sending that one in again to the company to try to get them to offer that. It's an easy compound that could be done relatively quickly, and I believe that we should do that, frankly. Any drug that we can get to, wow, it would make a huge, huge, huge difference. I want to take just a moment to talk about another fallen ALS angel. This is J.C. Hermstead, and as you know, she was from, I believe, it was Iowa, guys, or Ohio, and she had the very aggressive FUS gene, and they actually created a specific ASO for her called JC Fusion. I want to thank the FDA for working with them on that. There was supposed to be a trial, a very small trial, for people who had the FUS variant, and I'm not totally sure what happened, but I do believe that the FDA did not approve it, if I'm not mistaken, because the ALS Association actually had some money ginned up and lined up ready to go for that, and they did not end up doing it for whatever reason. But you all know the story, and most of you do, about JC. It's a terrible tragedy, absolutely horrible. Her twin sister also had ALS. It's devastating. But they actually called this drug JC Fusion, guys. Amazing. How cool would it be to have a drug named after you? I spoke with Mike, I think her uncle, a couple times. Great family. Just an absolutely terrible situation. Absolutely terrible. And I don't know at this point if the JC Fusion was as successful as they'd hoped. But, I mean, look, guys, we've got to take every possible opportunity to try these drugs when they're proven safe. And a lot of the drugs you're going to hear about the rest of this week are further along than some of these ASOs. It is not an understatement in any way to say that ALS could be treatable right now for the majority of us if we would just do it. We are not waiting on drugs, we're waiting on access, okay? That's the terrible time about this period, or a terrible thing about this period in ALS right now. We have drugs and we don't have the access. 2 years ago, we begged and pleaded all of our fellow pals to join this fight, and to all of you who have, thank you so much. And I know I'm going over some of this again that most of you already know, but we have a lot of new members, and I just want some of you to know the history of this fight. No More Excuses was started to push hard on ALS. In other words, to try to produce a result, guys. I mean, the reason is this. It's simple. We have the same prognosis in 2019 as it was in 1892. That's 140 years. Same exact thing they say, go home and die. Now back then, they didn't really know what ALS was. They may have called it Charcot's or these other things, but people, I can imagine these people living on farms back then. And all of a sudden one day, grandpa just starts losing his motor neurons. And I have no clue what they thought. It must have been terrible to watch them go all the way to death without even knowing what they had. It's terrible, absolutely terrible. As you can see, this is why I posted this again tonight, was every point matters, guys. Every point on the FRS score literally translates into quality of life. Look at this. Every point, they say, is 7% on the FRS scale. That's why no more excuses. We are fighting for every point for every person on this FRS scale every day without access to AMX. Some of you cannot afford it, and it's terrible. And we're fighting every day for Neuron's approval. We're fighting every day so they go ahead and approve AMX, and we're fighting for drugs like copper ATSM and all these other things. That's what we're going to bring you the rest of the week. We're going to go over the big list. The list of hope is what I call it, frankly. And this is it. This is it right here, guys. And there's going to be more. These are just the ones that basically I could put onto one slide. So I know here's the thing. All this is spinning around in your head. I know. Here's probably the best tool, I think, frankly, that you can use. It's from IMALS. They have a thing called Signal, and it's a dashboard thing that you can use to show you what trials are available. So if you are newly diagnosed to ALS, okay, if you're newly diagnosed, you need to go right here to this page I'm about to put up. And I'll post this below, of course, in the comments. But this will tell you whatever trial is available that you would be eligible for. It's a really amazing tool. This is it. I'll post the link for it, but it's called the IMALS Signal dashboard, and it shows you really, look at this, how cool this is, guys. This is cool, okay? And all I did was type in genetic ALS, and look, I got every trial that's available here. 067, tofersen, metformin, there's, recruiting a phase 2 trial there. BIB078 from Biogen. As you can see, guys, Biogen and Ionis are leading the way for familial ALS. I keep calling it genetic ALS. That's really not accurate. It's technically familial. I suppose you could say that, but some of it's about a protein malfunction. Sorry, Thurman. You're not watching. If you're calling me right now, that means you're not watching. So don't quit calling me and turn on the computer here. So don't really have too much more. I'd like to take a few of your questions. I'm going to sign off here in just a moment. I'm going to leave you with another Dr. Brown video where he talks a little bit about something that's a big problem for us in ALS, guys, and that is these trials. The way our trials are graded is with the ALS FRS score. We discussed some of this last night. We're going to keep talking about it, especially on Friday night when we talk about Neuron and some of these other drugs like AMX. Why does AMX look so good? And it met its primary endpoint. But there's a problem, and Dr. Brown actually identifies it very well here. He says it exactly how I wish I could say it, frankly. And I'll just let his words speak for themselves. Watch this video real quick, and I'll be right back. And this will be it. But I'd like for you to hear Dr. Brown. Listen very carefully to what he says right here, very carefully.
Right now, most of these companies pick very carefully the type of patients they want to treat. So they have inclusion, as you know, and exclusion criteria. And so that sets a kind of filter for optimizing patients who they think will respond favorably. If you broaden that and take all comers, let's say, and as a clinician, obviously at one level, I'd very much like to do that. But if you broaden the filters and you take all comers, and then there turn out to be some individuals who have adverse effects, the question is, will that taint the drug in the eyes either of the FDA or the marketplace in some way that's unfavorable for the company? I'm making no value judgments here. What I'm trying to share is what I think is the world of pharmacy's perspective on this. As a clinician, I'd love to see everybody get it. No question about that.
Okay, last thing I'd like to say, guys, is, and I think that was the right video. I think there was another video that he talked a little bit more about the differences. And if that's the case, I'll fix it in post and put it back up. That's what's nice about doing recorded interviews and stuff, is because if you make a mistake, you can fix it. I don't like doing live production because obviously it's up there forever unless you can go back in and fix it. So there may be some adjustments to this video, but all of these videos, this 5-part series, will eventually be available in a very well-organized format for all time. They'll be there. They'll be up on our YouTube page, which if you go to YouTube, you need to subscribe to our channel. It's ALS News Now. Okay, that's our YouTube page. You'll get to see a number of videos of people talking about their trial experience, which is why I was so thankful to Eric. Thank you, Eric Chun, again tonight for doing what you did. Everybody appreciates it so much for you talking about your experience. You are the first interview I've had about SOD1 or about familial ALS, so thank you so much for that. And the other thing I'd like to remind everybody, please, guys, you've got to watch this documentary. I know many of you have seen it now. Please spread it, share it, do everything you can. Guys, it's PALS is the name of it, P-A-L-S. It's on YouTube as well. I'll share the link later. But guys, this documentary has been amazing. Close to 10,000 views now. Shot by Dr. Bob Sennett's son, Matt, who was in those FDA meetings, and he's got a lot more footage. And to answer some of your questions, yeah, there's going to be a second part to this, and it's going to be way better. There's a lot more to this battle that you guys don't know yet. It's very, very shocking what's happening right now. All of you out there should have access to some of these drugs right now. There's no question these drugs are safe, they're effective, they work. And really what we're fighting now, guys, I hate to say it, we're fighting a defeatist mentality. We're really not dying of ALS at this point. We're dying of lack of being able to access these drugs and try. Some people have had incredible results, and I would urge everybody who has, please come forward. Now is the time to talk about your results. If you've had a result, if you've been in some of these trials, just like Eric, thank you so much again for doing that. And as I sign off here tonight, tomorrow night, we're gonna do this all over again, guys. And each night we'll have a different therapy. So Friday night will be neurone. That's our last night. Thursday night we'll have AMX35. Greg Cantor is coming back on again. It's going to be amazing. He's an amazing dude, and he will be back on. And then tomorrow night we'll talk about even more drugs. So, and you saw them in this list here. We're going to go over the next night's going to move. The next 3 nights are going to move pretty darn quick. We really had to get out of the way. I wanted to get out of the way familial drugs, and of course the introduction last night. So the next 3 nights. Take notes. Well, you don't really need to take notes because we'll have it posted. But if you see something interesting that you like and you have a question about it, send me a message. I'm overwhelmed with messages right now, but that's okay. Hopefully I can get to it eventually. Or go to No More Excuses, our website. No More Excuses is on Facebook. And I want to say thanks again for watching to this incredible series. And we have more guests coming. You really want to watch Friday night, I promise. You want to watch Thursday night because we're going to offer you guys real solutions, not stuff that's may show up in 15 or 20 years. No, everything that we talk about are things that, frankly, should be in our bodies, like right now, and could be if we would make a decision as Americans, as human beings, as compassionate people, to help our fellow men and women with ALS who are suffering terribly right now. So as we sign off, guys, I just want to say thank you. And I will see you again, hopefully, right here again tomorrow night, 8 p.m. Central, and we'll just keep doing it and doing it and doing it each night this week. And we've got to get access to some of these drugs, guys. We cannot wait any longer. And if we have to go back to DC to do another protest, we'll do it. That's what we're all about here. Action, not words. We don't ask for your money. All I want is just your help, your participation. And we are changing things. I know sometimes it doesn't seem like it, but we are. And these drugs that we're going to go over the next 3 nights could be used in every ALS patient's body. So thanks for watching this particular presentation. I know it doesn't affect as many of you as you'd hoped, but that's okay, because the one thing I want you to take out of it is, if you have not gotten a genetic test done, I would highly advise you to do that. And if that's the one thing that comes out of this video for some of you, then that's a huge victory. Perhaps some of you will go get a genetic test and learn that you have a genetic variant. And if that's the case, if you have SOD1, guys, you have an excellent chance of seeing treatment within the next year or year and a half, hopefully. So that's it. I will see you guys later. And guys, thanks. See you tomorrow night.